Long, sir.
Yeah, please.
Thank you. Welcome to all. We are here for a webinar on building confidence on COVID vaccine. And we all know that the situation is very precarious and almost everywhere the pandemic has created havoc. So it is our prime duty, prime concern that the Academy, being a part of this beloved country and also feeling the responsibility of science society mandate, must organize a seminar or webinar with the experts, the eminent experts, to convey the message what to do or what not to do. To begin with, about the situation, I would just like to read few lines which has been just written by me. हाहाकार है चारों तरफ, मृत्यु तांडव का मचा है शोर, मानवता है स्तब्ध, विज्ञान हतप्रभ, कुछ कर है इंसान कि बचे तेरा नामो निशान, हो एकजुट सभी की विपत्ति है बड़ी, और इतिहास गवाह है कि अदम्य साहस, सूझबूझ और मनोबल से हमने पहले भी कई लड़ाइयाँ लड़ी हैं और जीते हैं. So with this spirit and combat the pandemic COVID-19, which has grown with a strength of 2 years, 20 and 21, and also changed its attributes, its color, its flavor and flavor, giving more impact on the human health. So today we have very eminent scientists of the world repute. I would like to tell the first name, Honorable Professor Randeep Gularia ji, the Director of All India Institute of Medical Sciences, Padam Shri, a pulmonologist, and also who is having the first-hand experience dealing with this pandemic and coping with the hazards. So we welcome you, sir, in this seminar as the chief speaker today. And we have also many persons with us, very many eminent scientists, including our Honorable President, Professor Ajay Ghatak from IIT Delhi, who is our president, as well as a great physicist and a person known for his works on the light and other fields of the physics. We welcome you, sir, also. And we have the main crusader of this program with us, Honorable Madam Manju Sharma ji, who started this program with the announcement made by Honorable Prime Minister of India in October. And just after that, on 30th of October, we started this program with the Professor Balram Bhargava as the chief speaker at that very time. And since then, this is now going to be the 24th program of that series. We have already organized under the direction of Madam as well as the stewardship of the earlier President, Professor Padmanabhan sir, and now Professor Ghatak sir, the continuous programs on this awareness issue. This program was basically coordinated by Honorable Professor P.K. Seth sir, who is the coordinator of this program, as well as he is our past General Secretary, former Director of IITR, and former Chief Executive Officer of the Biotech Park, a known toxicologist in India as well as world. We welcome you, sir, also, and we are very much grateful for coordinating this event. This program, as I said, is full of many eminent speakers, and among them Professor G. Padmanabhan sir is there, Professor Dr. Anurag Agrawal ji is there, Professor V.P. Kamboj sir, our past president, and former director of CDRI. He is also here. And many others like Dr. Amita Jain and Dr. Sanjay Singh and Dr. S. Das from National Institute of Cholera and Enteric Diseases, ICMR. We have several others, and the chairperson of the Lucknow chapter, which is coordinating and organizing this program, Honorable Professor Pramod Tandonji, who is the CEO, presently the Chief Executive Officer of Biotech Park and the former Vice Chancellor of Northeastern Hill University. He's also here. We welcome you, sir, also. So with this brief introduction, I would just like to tell for those who are new for this academy, very briefly in 2-3 lines, what this academy is. This academy is the first science academy of this country, founded in 1930 by Professor Meghnad Saha, who was not only a renowned scientist at par with even you can say Einstein, he was also nominated 7 times for the Nobel Prize. And Einstein said about him that without Saha, we cannot imagine the thermal ionization. So with that stature and a person who was very close to Bagha Jatin, a great patriot. So with the foundation of this academy, the basic idea was to give a platform to all the Indian scientists to make them aware about the different aspects of the scientific organizations of this country as well as the scientific works of this country, and to request them to make them comfortable to think about the problems of the society. So science and society was configured as the mandate of this academy by Professor Meghnad Saha. Since then, we have many presidents, very renowned personalities of this world as our presidents. And they are now associated with the academy. Many of them are here also. And this academy is continuously for last 90 years serving science and society. This science and society programs are presently being steered by Professor Manju Sharma ji, who is also NASI chair, Women Scientist chair, as well as former director, former secretary to the Department of Biotechnology, Government of India. So now with this brief introduction, I would like to invite Professor Pramod Tandonji, the chairman of the NASI Lucknow chapter, because this program is being organized by the NASI Lucknow chapter, to say a few words as a formal welcome. Sir.
Very much, Dr. Neeraj. Can you hear me? Dr.
Yes,
Neeraj
sir.
Kumar. Okay,
Yes,
fine. Chairman of the webinar, Professor G. Padmanabhan, a very distinguished scientist, former director of Indian Institute of Science, Bangalore, inaugural speaker, Professor Randeep Gularia, who is director of All India Institute of Medical Sciences, New Delhi. All of us know him very well. Professor Ajay Ghatak, the president of National Academy of Sciences. Professor Manju Sharma, again, a very distinguished scientist and a science administrator, whom all of us moderators, Dr. P.K. Seth, the key person who has initiated this program, Dr. V.P. Kamboj, again, a very eminent scientist. And we have a panel that has Dr. Anurag Agrawal. He's the director of CSIR Institute of Genomics and Integrative Biology, New Delhi. Dr. Amita Jain, professor and head microbiology and pathology, King George's Medical University, Lucknow. Dr. Singh, director and CEO, Genova Biopharmaceuticals Limited, Pune. And this morning only we got the nominee's name from DG ICMR, Dr. Santasa Guj Das from National Institute of Cholera and Enteric Diseases is also going to be part of this webinar. Then Dr. Suchitra Banerjee, Secretary, NASI Lucknow Chapter, distinguished fellows and members of NASI, Dr. Neeraj Kumar, Executive Secretary, NASI, Ms. Archana Pant, participants, ladies and gentlemen. It's an immense pleasure to welcome all of you to this very important webinar on building confidence on COVID vaccines. As Neeraj said, NASI is the oldest science academy, and the main mandate of NASI is to promote scientific and technological research related to the problems of societal welfare. NASI has 21 local chapters across the country, and through these chapters has been conducting programs for science and society, science communication activities, awareness and training programs in various areas, and programs especially designed for socio-economic welfare of the tribal people. COVID-19 pandemic has hit the life of everyone in inconceivable ways. Strategies in the control of an outbreak are screening, containment or suppression, and mitigation. In order to create awareness about the pandemic and COVID-appropriate behavior, we at NASI Lucknow Chapter have organized many programs in the past few months. And I would few. When the pandemic began, we organized a virtual lecture for school children by Dr. Praveen Tandon, the masked man of Lucknow, entitled I Protect You, You Protect Me. For biology students and researchers, a lecture was organized on pandemic, novel coronavirus disease 2019, COVID-19, the unseen and unsaid by Dr. Shailendra Saxena, Professor and Head, Center for Advanced Research, King George's Medical University, Lucknow. Professor Suryakant, Head Department of Respiratory Medicine, King George's Medical University, Lucknow, spoke on COVID-19. Immunity is the best vaccine for researchers and journalists. A webinar in the series on bioresources for combating COVID-19 was organized under the leadership of Dr. Manju Sharma. For creating awareness on vaccination, Professor Shailendra Saxena of King George's Medical University, Lucknow, delivered a lecture on vaccination against COVID-19, building confidence amongst the people on the National Science Day in February this year. In this series of awareness programs on coronavirus disease, today we are organizing another webinar on building confidence on COVID-19. Over 1.2 crore people have registered as vaccination drive opened yesterday for 18 plus. Even CoWIN portal faced glitches. Now we need to ensure enough vaccines for mass vaccination program. While it is important to handle the present crisis with all resources at our disposal, it is equally important to work with full vigor to meet the future challenges. In India, genome sequencing of less than 1% COVID samples has been conducted. Bangladesh, our immediate neighbor, has geared up its facilities for sequencing on a bigger scale. There is a need to ramp up sequencing of the virus to know about the variants of concern and to understand what this means in terms of transmission, severity and impact, or potential impact on diagnostics, therapeutics, and vaccines. The Covaxin is found to neutralize 617 variant, a double mutant of COVID-19. While the healthcare infrastructure is improving slowly, there is a need to find newer and effective drugs and better treatment strategies. The scientific medical community can play a big role in our efforts to meet the current devastating crisis and prepare for future challenges. Community and health system resilience during a crisis of this kind is of paramount importance. In the face of present crisis, the need of the hour for all of us is to work on the ground more than ever before. Ladies and gentlemen, we are really fortunate to have in our midst very distinguished speakers and panelists, especially Dr. Gularia, a member of National Task Force on COVID-19, spearheading several programs at the national level. I would like to thank Dr. Neeraj Kumar and his team of dedicated staff for making this program possible. I extend a very warm welcome to all of you to this webinar. Dr. Seth has been instrumental in planning and hosting this webinar. Lauding his untiring efforts, I request him to take forward the program. Thank you very much.
Thank you.
Thank you, sir. Thank you, sir, for welcoming all the distinguished speakers and the guests in this program, as well as giving a brief introduction about the activities of the most dynamic chapter of Academy, that is the Lucknow chapter, as well as giving a panoramic view of the present situation. We are very much grateful to you, sir, for spending time and coming to this program. Thank you very much. For the next step, we are going to request Professor P.K. Seeds, who is an RC Senior Scientist, FMW Fellow. He is a fellow of all three science academies, a very reputed scientist in toxicology, and he was heading the IITR earlier and the Biotech Park, and also a very reputed person in the water-related work, also water toxicity also. He has done many programs with the Academy on the water and other toxicological parameters and peripheries of related area. So we request you, sir, to kindly introduce our eminent speaker today, and Professor Gularia, and also give a brief introduction about this webinar and this seminar. Sir.
Thank you, Dr. Neeraj. In fact, and thank you, Dr. Pramod Tandon, for accepting my request to organize this webinar. Hardly any need to emphasize the importance of this webinar. In fact, NASI, ever since this pandemic occurred in the country under the leadership of Dr. Mrs. Manju Sharma, realized that awareness is the key in containment of the disease. Because what are the steps the government is taking, the public is taking, the scientists are taking, it has to reach to the public in a real scientific manner so that they can understand. And as Neeraj just mentioned, that it was inaugurated as a Jagruta, Nasi Jagruta Abhiyan, and it was inaugurated by our beloved Prime Minister. So I will not go giving more of the webinar, but will just suffice to say, see, what is the importance of this webinar? The importance is that in spite of so busy schedule, Professor Gularia agreed to my request and gave the time and the time slot for holding this webinar. And Dr. Mrs. Manju Sharma guided us in developing a scientific program which has come out. Another important aspect is this, again giving the importance, is that this webinar, besides our president, Professor Ajay Ghatak, 3 of our past presidents are addressing this webinar. So this is very, very important. How much NASI is giving importance to it, that can be realized. The another aspect you can see among the participants is INSA President Dr. Chandrima Shah, who's attending. And so this webinar is going to be very, very important. I don't think people need to know about Professor Gularia because he is the most sought after the person by the policymakers, by the government, be in the scientific departments like the Indian Council of Medical Research, Director General of Health Services, DGHS, and also the departments of biotechnology, Department of Science and Technology, and all the departments. His advice is being sought. And the industry, the regulators, that which and how much regulation would be needed so that the people of the country can get the vaccine as early as possible, but at the same time, having as much safety as possible, no compromise. And that's where Professor Gularia has been playing a very, very important key role. I see that many younger people are there who are participating in this webinar. So I'll just very briefly introduce. He's the first Indian to get a doctorate in medicine, in pulmonary and critical care medicine. In fact, the Department of Pulmonary Medicine and Sleep Disorders has been created under his dynamic leadership in 2011. See how early he could visualize that this will be needed, and has been ranked as the best Department of Pulmonary Medicine in 2014, 15, 2016 by the Nielsen survey published in Week. He has been conferred with prestigious Padma Shri, has already been mentioned, in 2015, and also by the Dr. B.C. Roy Award in the category of eminent medical person in 2014. Obviously, he has published a large number of research papers and COVID, more than 400 publications, international and national journals are there, 49 chapters, various national and international books. He is member of many key committees and in containing the joint monitoring committees for the monitoring the outbreaks of new diseases, including pandemics, bird flu, Ebola, etc. And as already I have mentioned, the national policies, the antibiotic resistance in India, member program advisory committee, and on health sciences for the Department of Science and Technology, member project review committee of the Council of Scientific and Industrial Research. It's very brief introduction of Professor Gularia. I don't want to embarrass him. I know you are all looking forward to be listening to him, but before that, Dr. Sharma.
Thank you, sir, for giving introduction of Professor Gularia, sir, as well as this program. But as this program was basically mooted by Madam Manju Sharma ji, we would like to have a few words from Madam herself regarding this concept of this program as well as the success of this program. Madam Manju Sharma ji, Padam Bhushan, and also former secretary to the government. Madam Manju Sharma. She is an academic fever for this academy. Madam.
Thank you, Neeraj. A very warm welcome again to one of the most distinguished gathering I have seen in the last few days. Dr. Gularia, probably this is your charming personality which has attracted some of the best scientists and doctors in this webinar. So I accord on my behalf a very warm welcome to all the most distinguished personalities I see here today. As has already been said, NASI is the oldest science academy established by Professor Meghnad Saha. But what is important and what I want to bring to your notice is that Dr. Meghnad Saha, while establishing this academy, was all the time thinking of the society, the science and technology interventions for society. And thus he gave the mandate Science and Society. He also said, an academy of science can do a great deal by educating public opinion, and that is what we are doing. Undertaking particular problems. Yes, we have taken the problem of COVID-19 pandemic and bringing out scientific workers in various fields for discussion and cooperative research. But the main function of the academy should be towards cultural improvement by contributions to human knowledge, unquote. And when he said this thing, I think it was in his mind that whenever we are doing any, discussing any major problem which relates to the humankind, we have to ensure that there is cultural improvement, there is flow in the society also. And we know that for this particular pandemic, we always say COVID-19 pandemic and appropriate behavior. As soon as the Honorable Prime Minister Modi ji announced that we should have a Jagrukta regarding the pandemic, and we were in a pretty, the society was very under shock stage, and everybody was scared. So this Jagrukta Abhiyan that call was given by Honorable Prime Minister on 20th October. And of course, the three things which he emphasized, and I'm sure Dr. Gularia will be talking about that, was wearing the mask, social distancing, and hygiene, washing hands with soap several times, and cleanliness. So NASI took these three important aspects and organized. This is the 23rd webinar we have had, and we had 7 on nutrition and 16 on the Jagrukta Abhiyan for COVID-19. I will not talk about the programs which we have already had, but only I want to say that the program has spread all across the country. And we have gone to East, Kolkata, Mumbai, Dehradun, Varanasi, Lucknow, Imphal, Shillong, Jaipur, all the places we have covered. And the whole purpose has been that these events which we organized, which have been addressed by doctors from the medical colleges, the other colleagues from research institutions, from the universities, from NGOs, and many other eminent personalities, they come together on a platform which can discuss how are we going to tackle this whole issue, and can we take our voice, our awareness to the strata, the lowest strata of the society. That's the whole purpose. And you will be happy to know that NASI has a program called Rural Chowpals. And we have tried to, in spite of the pandemic, we have tried to take a few speakers to talk to the people there also. And not only that, NASI has also focused on the problems of tribal areas, where also the COVID is spread. And there we have organized such webinars. Most important point about our webinar has been that we bring very young people, students. In 2 or 3 webinars, we had about 20,000 students together. So very large number of students, young scientists, and so it is health workers, the frontline workers, and doctors, medical professionals, and above the scientists, certainly. So it is the consortium which meets, discusses all the important issues under the Jagrukta Abhiyan. That is what I wanted to explain. The last point here is that we have covered very important areas, such as the first one we had the inaugural seminar, which was held in NASI headquarters, was inaugurated by the Director General ICMR, Professor Balram Bhargava, and he gave a fantastic overview of the whole scenario of what is happening in the country, how the whole thing has happened, how we are tackling it, how we have gone ahead and enlarged the infrastructure, and so many other things, whatever best we could cover in the overview. We have also discussed not only the scientific biomedical aspects, but also the role of plants. CSIR is playing a very important role in using various plants, extracts, etc., which can be thought of for the cure of COVID-19. We have had COVID management lectures, we had prevention, public health intervention, the regional perspectives, for example, Northeast, how we are looking at the COVID scenario. And one very important lecture we had was from a brilliant young scientist from Indian Institute of Science, Bangalore, Dr. Raghavan Vardarajan. And he talked about the introduction to COVID vaccines. He said about the immune response, about the vaccines which are under clinical trials, the statistics on the existing clinical trials, etc., etc. He talked in great detail about the whole vaccine scenario of the country. Needless to mention that we have Professor G. Padmanabhan, who is also joined this, when he was the just immediate past president of NASI, and it was under his guidance and cooperation I got from him that I could organize so many webinars. So Professor Padmanabhan, who's the chairman of the vaccine committee today, has talked about different aspects, including the hesitancy of the vaccine, why people are hesitant not to use the vaccine, why people are scared, what is the importance of the killed vaccine which we have, the killed virus which we have in Covaxin, or the mRNA, or what Moderna is doing, or what Pfizer is doing. All these details have been given by Professor Padmanabhan in different lectures. It's very educating for the students, young people, and all these people, they come and join this webinar, then they go back and talk in their family. And I have noticed that today, even the housewives, the children in the families, younger people, they have become very aware. Real awareness has been generated because of this. Because those people who join these webinars, they go back and talk to the other people also, to the neighbors, to their own family members, etc. So it is very, very heartening to note that whatever NASI has made with this very meager resources, efforts, but certainly with the best cooperation of the scientific community, the biomedical community of this country, at all aspects, I think this is something NASI can feel very proud of. The entire scientific community and biomedical research community and the medical profession, we have all joined together to look at this whole problem of COVID pandemic. I think today when we will hear Dr. Gularia, in fact, I must say one thing, that Dr. Gularia, I don't know whether you are there, you are listening, he has become so popular, so important in this present pandemic, that the moment we see Dr. Gularia is coming on the television, everybody wants to come and hear him. That is what I have noticed. Everybody wants to hear you, Dr. Gularia, because they think that you are making very genuine statements. Your concern is very genuine. And also the statements which you give show the monumental effort our government is making. I mean, it is just impossible to say how much effort the government is making when we see our Honorable Prime Minister and when he is talking about all aspects of COVID with various professionals, industry people, scientists, and he is so concerned. At every state, he wants to know what is happening, whether it is the supply of oxygen or supply of vaccine or awareness building, whatever it is, or giving nutrition, immunity build-up, etc., etc. And many of these things, what our Prime Minister says, Dr. Gularia has been summing up in his expressions on the television very beautifully. And Dr. Gularia, I think many of the people sitting here, they have been admiring your lectures and brief introductions on the television. So I welcome you, and Dr. Seth, it's very nice that you have organized that webinar around Dr. Gularia. And what I want to say that NASI has a very strong feeling for science and technology intervention for the welfare of the people. And also has always thought not only its founder, but also the father of the nation, what Mahatma Gandhi said. Recall the face of the poorest and weakest man you have seen, and ask yourself if this is the step you contemplate is going to be of any use to him. And that's what we are trying to do, to see if we can reach the poorest of the poor in our efforts. Thank you so much.
Thank you, madam, for briefing about the academies as well as the program and giving a glimpse of the present scenario. And also, very briefly, I may say that introducing Professor Gularia also. We are certainly waiting for Professor Gularia to address, but just before that, I would like to request our Honorable President, Professor Ajay Ghatak, who was the professor in the IIT Delhi, as well as world famous scientist regarding his works on the light and other physics areas. And his many books are being read by the IITians and others, and they are very popular. Sir, please.
Dr. Manju Sharma, Dr. Padmanabhan, Dr. Prahlad Seth, Dr. Pramod Tandon, Dr. Kamboj, Dr. Neeraj Kumar, Ms. Archana Pant, and our most esteemed guest, Dr. Randeep Gularia. First of all, I would a warm welcome, very warm welcome to all of you. I'll make my lecture short because I totally agree with Dr. Manju Sharma that you speak so well and with so much of precision that whenever we hear that you are going to speak on television, we sort of leave everything and listen to you. And that has been a great contribution to the society at large. I'm so happy and delighted that the Lucknow chapter is organizing this very important webinar on building confidence on COVID vaccines, which happens to be a topic of extreme current importance. As already mentioned, NASI headquarters has launched a nationwide program for spreading awareness on COVID appropriate behavior as part of its science and society endeavor through a series of webinars led by Dr. Manju Sharma herself. We would like to express our indebtedness to her and all associated with NASI for their dedicated efforts in organizing so many programs all across the country and benefiting more than 30,000 participants, including students, scientists, and other academicians. Today, the whole country is unfortunately passing through a crisis of unimaginable magnitude. And the only way to get out of this crisis is by COVID-appropriate behavior and mass-scale vaccinations, which is the topic of our discussion today. We are all looking forward to Professor Gularia's talk today. As already mentioned by Professor Seth, he is not only an outstanding doctor and researcher, but he carries an enormous responsibility. And we are immensely grateful to him for sparing his time to address at this important event. I will not go into the details as to why we have got into this crisis, but one thing is for sure, the only way to get out of the crisis is through large-scale vaccinations. Therefore, at the moment, large-scale vaccination is the most important thing in our country, and how to build the healthcare personnel's confidence in COVID-19 vaccine. So with these very few words, I would like to give a very warm welcome to Dr. Randeep Gularia and express our deep sense of appreciation for finding the time to speak to us. And over to you, sir.
Sir, Professor Gularia, sir, Padam Shri, and a very known medical scientist. We would like to invite you for your address, which is being awaited by everybody, and a glimpse of your book, Till We Win. That I must say two lines about that. आप हैं तो एहसास है, जीतने का विश्वास है. Sir, with these few words, we request you. Sir.
Thank you very much. I'm deeply touched and humbled by your the words that have been said by the former speakers. In many ways, I've felt that I've just done what anyone would have done as part of his job. Thank you very much for your kind words. Dr. Manju Sharma, Professor Ashok Ghatak, Professor Padmanabhan, Professor P.K. Seth, Professor Kamboj, many other senior scientists and dignitaries who are on this webinar. It's indeed a pleasure to be invited for this webinar. And I shall be in the next about half an hour or so trying to give you an overview of vaccines as far as I can. Are my slides visible?
Yes.
Yes, they are visible.
Sir,
Okay. So the current situation, as we all know, is pretty grim if we start looking at what is happening in India, both in terms of the number of cases or in terms of our positivity rate, which in certain areas is actually more than 20%, but on average, we are around 10 to 20%, which is not a good figure. We also have the second highest number of COVID cases and the third highest number of COVID-related deaths in the world.
Sound is not coming.
Are you able to see my
please
slides?
share. No, sir. Please share.
Please
Not
share.
getting you, sir.
Okay. Are you able to see my slides now?
It is coming. Yes, sir.
Yes.
Now. Thank you.
Saying that we
No, audible, sir.
no, but my the sharing seems to go away.
Yes, sir. Yes, sir.
Just give me another minute.
This is Sanjay. I think it is important that
Sounds really
most of the video people should drop so the bandwidth will be available so Professor Gularia can share the slides.
Then everyone may please switch off their video. Yeah.
Oh, we cannot hear it.
Can you see my slides now?
Yes, sir. Yes, sir.
Right.
Okay, so what I was just saying is that although we have the second highest number of cases and we have the third highest number of COVID-related deaths in cases per million, if you were to look at it, our numbers are still on the lower side. So, but however, the picture is quite grim. Now, I think what we haven't had learned is what we saw as far as the Spanish flu was concerned. And in 1918, when the pandemic occurred, there were actually three waves: the first wave, the second wave, and the third wave. And what actually happened after the first wave was that people felt that the pandemic is over, and there was a lack of appropriate behavior. Many people started going out, having parties, and this led to the second wave, which was much larger and more serious as compared to the first wave. In a way, we are seeing history repeat itself. And if you look at the data from India at that point in time, which was part of British India, the data was pretty similar in terms of the very high mortality that occurred in the second wave. Of course, at that point in time, there were no vaccines available and treatment strategies were not that much as compared to what we have today. But at that point in time, masks were still to be worn. There was still a hesitancy and resistance for what I would say is non-pharmacological measures to decrease the pandemic was still present at that point in time. And we are now globally seeing the second wave, and so is the case in India. The challenge in India has been that the spike or the rise in number of cases has been very, very dramatic, and it has really shaken the healthcare infrastructure because of the dramatic rise in the number of cases. Now, we did a lot of things, and this is just to say what AIMS did. We started in last year in February a COVID-19 task force. We formed various committees looking at resource management, diagnosis, so that the supply chain could be maintained. I've been having a meeting almost every day with the faculty members, nursing officers, residents, our technicians, and other staff to really resolve issues and try and see how we can really aggressively manage the pandemic. And a large number of strategies were created as far as the AIMS was concerned. We converted our National Cancer Institute into a COVID center. We trauma center was also converted into a COVID hospital, and we created almost 1,700 beds. Now we have actually more than 2,000 beds. And this was last year we were having 800 to 900 patients per day. We have crossed 900 today. We have more than 900 patients who are sick as compared to last time. All of them are on oxygen or on high flow nasal cannula, many requiring ventilatory support. So the situation is pretty grim. I have more than 100 patients currently waiting in the emergency for a bed. We are rapidly trying to create more and more beds. The challenge, of course, is to have regular supply of oxygen, because that becomes is necessary as we try to expand our infrastructure. This is the National Cancer Institute in Jhajjar, which we've converted. This as a hospital, an OPD, and a research block, which has been converted now into a totally cancer hospital. This is it from the ground floor. On the left, the building coming up is the Infosys Vishram Sadan for the relatives and cancer patients to stay who are on daycare chemotherapy. This is a trauma center, which is again having 260 beds. We've converted this into a COVID hospital. Behind this, we have the Burns and Plastic Surgery Center, which has also been converted into a COVID hospital. And this will give us another 100 beds. We've also converted our main hospital, the H block floors, into COVID centers, and also one area for our staff as far as COVID care is concerned. We also started very early in February research. This thing, the institute itself decided that we will promote research, and we created an intramural grant to promote COVID-related research. In the first proposal in March last year, we got almost 178 proposals, 63 were funded, and till December of last year, more than 200 papers have been published in various national and international journals. And there is a lot of collaboration between IIT Delhi and AIIMS, IGIV, THSTI, and this has really led to a good quality research being done as far as COVID-19 is concerned. Coming to the vaccines, vaccines have been touted as a weapon to win the war. This is what came out in December when vaccines were first introduced. However, the Economic Times clearly mentioned that vaccines alone will not end the pandemic, and there was a hope of there was hope, but there was also some degree of cynicism. So our vaccines have been touted and have been shown from the time of Edward Jenner, when the smallpox vaccine was introduced, to be the most effective public health measures to end outbreaks and pandemics. It has been now given under emergency use authorization to millions of persons and has been touted as the beginning of the end. However, many questions remain. Are vaccines truly safe and effective? Will they prevent disease transmission? How long will the benefit last? And will vaccine work against the new strains? These are questions which are important to answer if we have to build confidence as far as COVID-19 vaccine is concerned. So just to give you a brief oversight, vaccines we know produce an immune response of the host against pathogens without exposing them to this disease. We have now over 60 vaccine candidates which are undergoing human trials and over 180 in preclinical trials. For one virus or for one disease, this is unprecedented, the number of vaccine candidates that have been tried out. But it's important to remember that vaccines, we need to see whether they prevent infection. We would ideally like to have vaccines which prevent infection, but we know that this may not be possible. The other is vaccines to prevent disease, and this would mean hospital admissions, preventing ICU admissions, and deaths. Most vaccines we know are very effective in preventing disease, but you may have asymptomatic or polysymptomatic patients who may have the infection and therefore may be infectious. We would also like an infection vaccine to be effective in preventing transmission. Just to give you an overview, vaccine design, the important issues are selecting an antigen which will produce an antibody response. We all know that for all vaccines, it's the spike protein which has been used as the antigen as far as the COVID-19 is concerned. And then we need a platform which will put the vaccine into a person to really incite an antibody response. And there have been a large number of platforms which have been tried. Along with that, of course, we have to look at the route and regimen. And the route currently continues to be an intramuscular route but there are nasal vaccines which are being tried. There's an intradermal vaccine also which is being tried. And we have to look at whether this can be more effective in terms of causing more mucosal immunity and have a better response as far as the body is concerned. So we have a whole array of vaccines. We have the inactivated vaccines, the live attenuated vaccines, the viral vector vaccine, which can be replicating and non-replicating, the nucleic acid vaccines, the RNA vaccine, the DNA one, and of course the protein subunits, the VLPs, the virus-like particles, and the others which are available. We all know that the inactivated vaccines are something which have been used for quite some time. We have the weakened virus, which is the Codagenix, which is being tried by Serum Institute. We have the inactivated vaccine, which is Covaxin and Sinovac, which is currently being rolled out. And there is a lot of feeling that since this uses the whole viron, this may have better protection against the variants which may emerge because of this factor. Again, we have the nucleic acid vaccines, the vaccines which are by Pfizer and Moderna, the mRNA vaccine, which use both the technology by which the nucleic acid is inserted into the human cells. And these vaccines have also been shown to be highly effective as far as the vaccines are concerned. A DNA vaccine, which is by Zydus Cadila, the ZyCoV-D, which is part of Zydus Cadila and DBT, is also under trial. The viral vector vaccines we're all aware of are either the replicating or the non-replicating viral vector vaccines. And here again, we have Covishield or the AstraZeneca vaccine, which is basically a non-replicating viral vector vaccine. And same is true for Sputnik, which uses the Covishield uses the chimpanzee viral vector, whereas Sputnik uses the human adenovirus as a viral vector. The protein subunit is also another virus vector which another vaccine platform which is used. We have almost now, I would say, 69 vaccines which are undergoing clinical development, and protein subunit vaccine account for one third of these vaccines. So there's a whole platform as far as vaccines are concerned, and a lot of confidence is there that we will have a large number of vaccines of different types available for us in the coming months or years. As far as India is concerned, we have Covishield, we have Covaxin, Zydus Cov by Zydus Cadila, Sputnik, which is by Dr. Reddy's laboratory. Serum Institute of India is coming out with the Novaxin. We have also Biological and Genova coming out with their vaccine, and Bharat Biotech is also looking at an inactivated rabies vector platform vaccine. So there is a very robust scene as far as research in vaccine is concerned. And I think this is something which is very, very heartening. For a long time, India had been a manufacturing hub, but R&D was something which was not being done as aggressively as it is being done now. And we see now a lot of new platforms being looked at by Indian researchers. And a lot of hope is there that this will help in the future also for new vaccine candidates. Now, what is the evidence of efficacy from vaccine trials? And we all know that we go from preclinical phase 1, phase 2, and phase 3 trials. Preclinical look at safety and immunogenicity. Phase 1 will look at dose ranging, safety and immunogenicity. And phase 2, which looks at a larger sample size, it looks at immunogenicity and safety. And ultimately, we do a phase 3 study, which is more difficult to do because you need thousands of patients, but it looks at field conditions in terms of the efficacy of a vaccine. Now, what should be the vaccine efficacy for COVID-19 to be licensed? And this has been something which has been approved by the WHO, that the vaccine efficacy is basically the attack rate in unvaccinated minus the attack rate in vaccinated divided by the attack rate of unvaccinated into 100. This is pre-specified as far as vaccine trials are concerned. And US FDA and WHO has actually said that the minimal efficacy criteria for licensure should be that it should be more than 50% as far as vaccine efficacy is concerned. What is very heartening is that most of the vaccines which we have currently have an efficacy which is actually 70% or above, even in the 90s. And therefore, this is something that we need to do. We need to understand. But we also need to look at studies which assess the severe COVID-19 as an additional endpoint. Now, these are various studies which have been done. Of course, this is looking at the AstraZeneca vaccine, which actually looked at 2 doses, 28 days apart. The overall efficacy was around 70%, and this was something which was heartening as far as this vaccine was concerned. What was interesting is that in participants who got a half a dose to begin with and got the full dose later on, the efficacy actually went up to 90%. And this is something which was interesting as far as this vaccine is concerned. This data needs to be looked at more critically. looking at how does this work, how does a single dose work, and this was something which was published in March, where it was found that if the booster dose was given between 4 to 12 weeks post the first dose, based on limited data and a lot of statistical analysis, it was felt that you could have a better immune response if this was done. Vaccine after second dose, depending on the interval between first and second dose, actually went up from 55% to almost 80% if it was given after 12 weeks. And based on this, the WHO also recommended that the AstraZeneca vaccine may be given between 8 to 12 weeks. Coming to the Pfizer vaccine, this is an mRNA vaccine which encodes a spike protein. Again, the challenge with this vaccine is that it needs to be transported and stored at minus 70 degrees centigrade, and therefore would be difficult. But it provides almost 95% protection against symptomatic COVID-19 in persons 16 years and over of older age group. Then, of course, we have the Modona vaccine, which again is effective and is again an RNA-based vaccine. Multiple studies have shown that this is again something which has a very high efficacy of around 94% against symptomatic COVID-19 in persons 18 years or older. The Bharat Biotech vaccine in phase 1 showed a very good response using a 3 microgram and a 6 microgram dose, and the efficacy was very good in terms of seroconversion, and subsequent data which Bharat Biotech released showed an efficacy of around 81%, and this was data from what they had from the phase 3 interim analysis of around 130 confirmed cases at that point in time. So now coming to what are the major challenges that we face. First of all, what about the new strains? And we know of the three strains which are definitely a cause of concern: the UK, the South African, and the Brazilian or Japanese strain lineage. These strains have more than one mutations. As a matter of fact, multiple mutations, and many of them are in the region of the spike protein or the receptor binding domain. And it's been shown clearly that as far as the UK strain is concerned, it has a very high transmissibility, and that is the cause of concern, because one of the factors for the increasing number of cases that we are seeing in India seems to be because of the UK strain, especially in Punjab and northern part of India, where the data from the genome sequencing does suggest that this is becoming more and more dominant. Then we have the South African strain, which is again the cause of concern, because there is some data that vaccine efficacy may come down. And then we have again the Brazilian strain, where there is again a chance that it has increased transmissibility. So how does these strain actually affect the vaccine? Now, there are studies which have looked at this. This is the efficacy of vaccine against the UK strain. And this was basically looking at the UK lineage and the Pfizer vaccine. And this was able to show that although the efficacy came down a little bit, it was still strong enough, and the immune sera had a slightly reduced, but overall largely preserved neutralizing titer against the UK strain, looking at a pseudovirus. Similarly, if you look at data from Moderna and the other data, it does suggest that the efficacy of the AstraZeneca virus against the UK strain is quite good, and there were no significant impact as far as the variant was concerned. This is all from vaccine, the Bharat Biotech data, which again suggests that this vaccine should be effective against the UK strain as far as the neutralizing activity is concerned. There has been concern as far as the South African strain is concerned, and this data, which is looked at plasma from recipients of the mRNA COVID-19 vaccine, showed that there appears to be maintained neutralizing activity against the South African strain, but at a lower titer than the wild type strain. Again, for the Novavax COVID-19 vaccine, again the efficacy has been good as far as the South African strain is concerned. The cause of concern has been this paper, which was published in March in the NEGM, which again looked at the AstraZeneca vaccine against the South African strain. And this is something that they looked at around 2,000 HIV uninfected adults in South Africa. And what they found was that the efficacy of the vaccine in this small sample size, because only 23 out of 217, that is 3.2% in the placebo arm, and 19 out of 750, that is 2.5% in the vaccine recipient, developed mild to moderate COVID-19. But based on this data, they've suggested that the vaccine efficacy was only around 20%. However, the sample size was very limited. And this is what they were able to show, that the neutralizing activity came down significantly when they started looking at the South African strain. And they actually concluded that 2-dose regimen of the AstraZeneca vaccine did not show protection against mild to moderate COVID-19 due to the South African variant. So this is something that we need to look at more critically. But then the issue is, could COVID-19 vaccines be tweaked to cover the new coronavirus strain? And I think this is something that can easily be done. Currently, there is little evidence to suggest that the UK or the South African strain variant could escape the immune protection afforded by the current vaccines. However, there is a concern that this may happen subsequently with further mutations, and this could render the vaccines less effective. Therefore, there are two things that we need to do. One is have very good surveillance in terms of seeing whether new variants lead to a decrease in vaccine efficacy, and also then be able to talk to the manufacturers as to how they could tweak the subsequent batches of the vaccine so that it is effective against the variant strains. This is something that we do regularly as far as influenza is concerned. Influenza is another virus which undergoes what we call an antigenic drift. And the antigenic drift leads to new vaccines every year with new strains, both for the northern and the southern hemisphere. And I think that is something that we may have to do for COVID-19 also. Vaccine hesitancy is another major issue which we need to address. WHO, as a matter of fact, had listed it as the top 10 global health threat in 2019. And this has become a major obstacle in various parts of the world in terms of achieving vaccination coverage. And we need to address this in terms of public perception and misinformation which may be transmitted as far as the COVID-19 vaccine is concerned. Various papers have tried to look at the cause or the factors that affect vaccine hesitancy. And these include vaccine characteristics. Some people are worried about the type of vaccine when we talk of the RNA or the DNA vaccine, the efficacy, the duration, safety, and side effects. There are also concerns about approval processes. Some argue that it's too fast, it's under political influence, and maybe proper efficacy and safety studies were not done. So I think there is a need for all of us as scientists to really address these in the public so as to overcome the issues of vaccine hesitancy. It may not be a big problem in India, although this is something which was promoted by this paper which came out in the Lancet early this year, which actually suggested, based on the questionnaire that was done across the globe, that 90% of people in India were ready to get vaccinated in this recent survey. So in India, it seems that the vaccine hesitancy may not be as much as it is in some parts of Europe or in the US, but still we need to address it because a lot of social media has created hesitancy among not only the general public, but even among healthcare workers. So how do we tackle this? I think it's important that healthcare workers can provide vaccine acceptancy by making direct recommendations for vaccination, identifying all concerns that individuals have, educating patients and the public on vaccine risk and benefit. There has been this whole concern of the so-called blood clots which could occur with the AstraZeneca vaccine, and dispelling misconception about the disease and the vaccine. The other issue is the duration of protection. How long does the vaccine protect us? The duration of protection is something that is a concern among the public health policy makers. An ongoing follow-up trial and observation is needed to address these issues. It is also important as we go along, and this is something that we've been able to do in terms of looking at the blood clot issues, to identify rare and delayed adverse events of vaccination. And that's why surveillance is very, very important. The vaccine-induced immune thrombotic thrombocytopenia, which is being reported, is very, very rare, but it is being linked to the AstraZeneca vaccine. Now, will vaccines end the COVID-19 pandemic? I think whenever we talk of a vaccine program, we'll have to look at 4 basic things: the development and production of the vaccine. Is robust enough to provide enough doses? Affordability, the vaccine has to be affordable so that it can be rolled out for mass production. You have to have a robust mechanism of deployment so that the supply chain is maintained, the cold chain is maintained, and it can reach everyone in that manner. And then there has to be equity and allocation done, keeping in view individual countries' priorities. So it's important to understand that vaccines and not vaccination and not vaccines will prevent infection and save lives. You may have vaccines, but if you are not able to vaccinate, it will not really help. And that's something that we need to really understand. Who should receive the vaccine and who should not? Who are the high priorities? And something that needs to be decided and was done somewhere in August or September by the task force which was formed as far as this was concerned, the NEGVAC, as far as India was concerned. And of course, then you have to look at various other issues. So until sufficient quantities of vaccine are manufactured for universal distribution, deployment of limited vaccine supply has to be equitable and efficient. And if we are able to do that, then vaccines may help in ending the pandemic because they will really help in improving the immune response. And this is something that we need to keep in mind because this will subsequently be of great importance as far as the overall immunity is concerned in the general public. If you currently look at what has been put out by various manufacturers, Pfizer has actually said that in 2021, they would be able to supply up to 1.3 billion doses. Modona has said that they can supply up to 500 million to 1 billion doses. AstraZeneca has committed up to 3 billion doses, and Covaxin, the Bharat BioShield, has said that 700 million doses would be available this year. So we have a number of doses which are available, which should be sufficient. But the important issue is that except for the AstraZeneca and Covaxin, the other two vaccines need a more robust cold chain, and cost can also be a factor. Will these vaccines really be helpful? This is a study which was from Israel, which looked at the Pfizer vaccine, and it found that it had a vaccine was effective for asymptomatic infection in up to 90% of individuals. And it was found to be very useful as far as bringing down the number of cases in Israel was concerned. I'll just come to that in a minute. Also, if you look at the AstraZeneca vaccine, the data from this study in the Lancet, which was published in December, also showed that it did help in decreasing transmission because there were fewer asymptomatic SARS-CoV-2 infection in those who were vaccinated as compared to the control group. And therefore, it was felt that COVID-19 vaccination could help in reducing transmission. In Israel, it was reported as being very successful. Remember, Israel has a smaller population and it's easier to vaccinate a large number of their population, but they were able to do that successfully. And they found that a single dose efficacy at had a significant response of 51% decrease as far as the infection was concerned. 2 cases and illness declined significantly 2 weeks following first dose as per the health ministry data. So vaccination will help in decreasing number of cases. Only issue is that since our population is large, we need to do that at a much larger scale. Developing vaccines is only half the work done. We have to have equitable distribution. Manufacturing billions of doses is the current challenge, but having an equitable distribution is something which is very, very important. If you look at data, it suggests that if you were to vaccination was distributed to high-income countries first, we would avert only 33% of deaths. If they were distributed to countries based on population, we could avert 61% of death. Therefore, equitable global vaccine supply and administration is our best bet to end the pandemic. However, the distribution is quite skewed. If you look at global perspective, there are many countries which have ordered vaccines or pre-ordered vaccines, which are more than their entire population. Canada, United States, United Kingdom have offered vaccine doses almost for 6 times that per person. So 6 to 8 times doses per person have been pre-ordered by many countries, and this is leading to a skewed distribution. So 5 wealthy nations and the European Union, which accounts for 13% of the global population, have ordered more than 50% of the doses of vaccine. That is why WHO set up COVAX in an attempt to really get vaccines to various parts of the world, and they plan to have 2 billion doses in 2021 because a large part of the world otherwise will not get vaccinated. Cost comparison also, if you look at the Indian vaccines, the Bharat Biotech and the AstraZeneca vaccine, they are they're cost effective as compared to the other vaccines which are available, which are much more costly. So these are vaccines which are easy to use, cold chain requirement is not much, and they are much more cost effective as compared to the vaccine which are available, let's say in the US. Indian rollout vaccine has been really robust. We have now, this is old data, we have really gone way ahead of this in terms of the vaccine, the people that we're vaccinating. And from the 1st of May, we are opening it up to vaccinate more and more people as far as India is concerned. There's also been data which is trying to look at, do our vaccines cover for the new variants? And it has been shown that by various studies done by ICMR, that Covaxin has been found to be effective in neutralizing the double mutant strain as well. NIV has been able to isolate and culture the double mutant and the UK and the South African strain. And there is robust data which suggests that the current vaccines in India should be effective against these new variants as far as India is concerned. We have a robust platform, the CoWIN platform, which looks at vaccine delivery right from the manufacturing to the primary health center in one phase. The other part of this platform looks at the delivery of the vaccine from the sub-center to the registration to the giving the vaccine to the beneficiary, and then following it up in form of forming a unique health ID, a QR code, and giving a certificate and monitoring for adverse effects following immunization. So to conclude, vaccination is an important public health measure to end the pandemic. There is no doubt about this. Several vaccines have got emergency use authorization based on adequate immunogenicity and clinical efficacy. But we need to develop measures to ensure a quick, efficient, and equitable delivery of vaccines. We also need to develop measures to make sure that there is confidence in terms of addressing vaccine hesitancy in our population. And current vaccines retain efficacy against the new variants. However, vaccines may need to be tweaked if newer strain develops an immune escape phenomena. We really don't know and need to explore the duration of protection and the long-term adverse effects, if any, as far as vaccination is concerned. But I would like to stress again that despite vaccination, public health measures like social distancing and masks must be continued till population, a large part of the population is covered by vaccination and the caseload in the community declines. So although vaccination is something that we need to push forward in terms of building confidence, COVID appropriate behavior, preventing crowds, and making sure that we break the chain of transmission as far as infection is concerned is more important currently as the vaccine program builds up. Thank you very much.
Thank you, sir, for such an interesting, illustrative, and informative talk. I would like to invite Honorable Professor G. Padmanabhan, sir, for making any comments, as well as to preside over the panel discussion. Professor G. Padmanabhan, sir, is the immediate past president of this academy and former director, Indian Institute of Science, Bangalore, as well as a world-known and famous biotechnologist. Sir, I would like to invite you to say a few words about this lecture as well as preside over the panel discussion. Professor G. Padmanabhan, sir. Padam Bhushan, Professor G. Padmanabhan, sir.
Thank you, Neeraj. Professor Gularia has covered a vast ground, and I don't think I need to comment on that. This is something which we have tried to cover in maybe 16 webinars. Thanks to Dr. Manju Sharma. We have been trying to cover many aspects, and I have had occasions to talk about the virus. But Dr. Gularia has phenomenal, as usual, covered a very vast ground of what issues with this vaccine, and definitely vaccines hold a promise. At the same time, emphasize we can't lose sight of COVID appropriate behavior. Thank you, Dr. Gularia, for a wonderful lecture. It's been a privilege to listen to you. I don't want to take much time because there are 4 eminent speakers who are going to talk following. So I just want to make one comment, which is my concern. That is the production capacity in India. I am aware Serum Institute is probably making 60 to 70 million Bharat Biotech is making less than 10 available. That means we have less than 100 million doses available per month. And with the government opening up 18 years above for the vaccine, that means we have something like 80 crore population. And if we assume 2 doses, 160 crore, of which probably we have covered 16 crore. Only concern is, because I chair this vaccine evaluation committee of DBT, which is going to support Bharat Biotech. They have put up a 10,000 liter plant in Malur, Bangalore, and where they hope they may be able to push up to 50 million doses per month. And if Serum Institute also pushes up, say, more than 100 million doses, even then, Sputnik or from US, I'm not very sure, where is it 1,500 million doses? That is my concern, because if we can cover the population within this year, that means we need to have something like 300 million doses per month. I'm hoping, we will have new vaccines. We will have Sanjay coming in with his self-amplifying messenger RNA. I'm sure he is going to talk about it. It's a very, very unique messenger RNA concept, which he is going to talk about, and there are others who will talk. But the only point I want to highlight is a bit concern about the production, whether we will be able to cover the entire population, which is above 18 years, before the end of this year, with the capacity that right now we have only 2 vaccines. Now, will we be making, probably an mRNA will come within 4 months, 5 months? Will a protein vaccine from biological E will be ready in another 3-4 months? Will we be importing? I don't know. China is always probably ready to supply. I don't know how we will make up the gap. That is my one concern. I may not be fully informed, but I thought this is the one concern. And, again, want to thank Dr. Gularia for a phenomenally vast coverage lecture, which must have satisfied a lot of people to know about the vaccine, importance of the vaccine, rightly emphasizing it's not going to be the only solution. We cannot lose sight of the COVID appropriate behavior. Thanks to Dr. Gularia once again, and I throw open, I think, my colleagues, 4 eminent speakers are going to follow, and the moderators are, I think, Dr. Seth and Dr. Kamboj. I invite them to start the process. Thank you.
Professor V.P. Kamboj is the past president of this academy as well as the former director CDRI, and he is a well-known medical biotechnologist, as well as during his period at CDRI, many new drugs were invented. So we request you, sir, to kindly take this moderation and invite other scientists to say a few words in the panel discussion. Professor V.P. Kamboj, sir.
Sir, you have to unmute yourself.
Professor Kamboj, sir, please unmute.
आपने अभी डॉक्टर गुलेरिया से आई ओपनिंग लेक्चर सुना और वैक्सीन में हेसिटेंसी के लिए उन्होंने एक बात कही। मेरे ख्याल में वैक्सीन ही एक ऐसी चीज है जो किसी भी पेंडेमिक को एंड कर सकती है या किसी भी डिजीज को खत्म कर सकती है। जैसा आपने देखा कि स्मॉल पॉक्स को वैक्सीन ही ने इरेडिकेट किया और पोलियो जो इतनी डेबिलिटेटिंग डिजीज थी उसको भी वैक्सीन से खत्म किया गया। ड्रग जो है ट्रीटमेंट प्रोवाइड कर सकती है जब कोई बीमार हुआ, लेकिन इरेडिकेट नहीं कर सकती किसी चीज को भी। और इसीलिए वैक्सीन के बारे में जो हेसिटेंसी उन्होंने कहा, हमारे ख्याल में तो हेसिटेंसी शायद खत्म हो रही है। यदि आज आपने 18+ का रजिस्ट्रेशन देखा, 1 करोड़ से ज्यादा लोग रजिस्टर्ड हो गए और जिन्होंने पहले ओल्ड पॉपुलेशन ने वैक्सीन नहीं ली थी वो भी 1 किलोमीटर लंबी लाइन में मुंबई में आज दिखाया गया खड़े थे। इसलिए वैक्सीन के जो हेसिटेंसी है वो एक तो मीडिया ने बहुत क्रिएट कर दी है और उसकी वजह से है। और शेर साहब ने जो पैनल चुना है मेरे ख्याल में 5 या 6 मिनट प्रति स्पीकर को मिलेंगे। उसमें है डॉक्टर अग्रवाल जो IGIB के डायरेक्टर है, जिन्होंने जीनोम सीक्वेंसेस में बहुत लीडिंग रोल प्ले किया है प्लस सर्वेलेंस भी किया है। अमिता जैन जिन्होंने डायग्नोस्टिक के लिए किंग जॉर्जेस मेडिकल यूनिवर्सिटी में बहुत लीडिंग रोल प्ले किया है। दिन रात उन्होंने मेहनत करके RT-PCR टेस्ट जो थे यूपी में एस्टेब्लिश किए। संजय सिंह जो एक नवयुवक एंटरप्रेन्योर है और जो नई किस्म की मैसेंजर RNA सेल्फ रेप्लिकेटिंग मैसेंजर RNA वैक्सीन जो फेज 1 फेज 2 ट्रायल में चली गई है। और डॉक्टर दास जो डायरियल वैक्सीन में बहुत देर से काम कर रहे हैं। बहुत ही अच्छी पैनल इन्होंने चुनी है। हमारे ख्याल में हर पैनल स्पीकर को पहले 5 मिनट दिए जाएंगे और उसके बाद जो क्वेश्चंस होंगे उसको फेस किया जाएगा। मुझे माफ करिएगा मैंने हिंदी में शुरू कर दिया कि हिंदी भाषा जो है मैंने कहा सभी अंग्रेजी में बोल रहे हैं, भारत की भाषा थोड़ी सी जाए। डॉक्टर अग्रवाल साहब स्टेज इज ओपन फॉर यू।
थैंक यू वेरी मच एंड मुझे बहुत अच्छा लगा कि हिंदी में शुरुआत हुई एंड डॉक्टर गुलेरिया ने जो उदाहरण दिए थे बहुत सारे दोज वर एब्सोल्युटली एक्सीलेंट। मैं थोड़ा सा बैक टू इंग्लिश लाता हूँ बिकॉज म्यूटेशंस के बारे में जब बात करनी होती है English becomes my preferred language. I will start from 2 things Dr. Gularia talked about that are absolutely critical. He pointed out that neutralization of the virus occurs by antibodies towards the spike protein, which then binds to the ACE2 receptor. This is particularly the RB2 receptor binding domain of the spike protein. And if you can have antibodies preventing this interaction, you get effective neutralization and the virus cannot enter. Now, this is the essence of one level of vaccination success, but this is also exactly where genomic surveillance comes in. From the time this virus has started, we have seen continuing evolution of the virus in terms of mutations, particularly in the RBD domain. Now, the most important one that I can talk to you about to start with is D614G. Every time I use this, you have an amino acid, a number, and a changed amino acid. And you will find that D614G within a few months pretty much replaced every other strain out there because of better binding to the ACE2 receptor, which made it more effective, which allowed it to propagate better. Now, if you look at what has happened in the world, and Dr. Gularia showed very importantly the second wave, one of the reasons for complacence after the first wave is because people have infected, people have recovered, people have antibodies, sometimes people are vaccinated, they believe it can't happen to us again. The best example here of this would be Manaus, Brazil, where approximately 7 months after the first surge, because of the emergence of a new strain called P1, with a mutation called E484K, which severely inhibited binding of antibodies and, of course, very importantly, as Dr. Gularia said, abandonment of COVID precautions, they saw a massive surge much larger than the first. Now, what happened in India? Have we seen these variants of concern? As of this moment, there are 3 variants of concern clearly in the world. One is called B117 from the United Kingdom with a critical mutation N501Y and many others. There are at least 21 other things you could look at. It increases infectivity and is a little bit of immune escape property. As far as we know, our vaccines should be able to handle it well based on UK data. The second is the Brazilian mutation, which basically has not come to India except in foreign travelers. And the third is the South African, where we know that Covishield has had difficulty with mild disease being prevented only in about 10 to 20%, but severe disease being effectively prevented, as Dr. Gularia said. All of these mutations have been found in India, but of these, only B117, the UK variant, has rapidly spread to the extent that in Punjab, 90% of cases, same thing is seen basically now in Delhi. And at the same time, we've been creating mutants in India, which is not surprising. These mutations occur inside human beings. The more infected humans you have, the more mutations you will make. Given the number of mutations India has, we don't need to look outwards. The most important future variants of concern are likely to come from India itself. And we have already seen one, B.1.617, coming out of Maharashtra. Very recently, Professor Sujit Singh at NCDC mentioned it has become almost half, rising very fast in Delhi. It is rising fast in many other states of the country. And we need to keep an eye for this in terms of what they will do for vaccines. As Dr. Gularia said, this particular, so also called double mutation, there is some neutralization activity of both Covishield and Covaxin. So things don't look bad from a severe disease point of view, but we need to keep watching this as we go forward. And I think watching for these variant strains will be one of the most important public health surveillance measures that we must do. Sequencing alone will not be sufficient. Integrating everything together will be critical. I'll stop here now, sir.
Thank you, Dr. Agarwal. May I now request Dr. Professor?
Yes, sir. Yes, sir.
Okay.
Yes, sir. I'm available.
Sir. Yeah, please.
Thank you, Dr. P.K. Seth, for this opportunity. It's in fact an honor to be present amongst a galaxy of scientists who are here. So some of them I just knew by name, and it's nice to see them in person also. Thank you for the opportunity, sir. I come from the diagnostics, and I am a microbiologist who has been working in the diagnosis. So I thought I'll address some of the frequently asked questions which are related to the testing. One of the questions which people often ask is that if I am vaccinated, do I get a false positive result on RT-PCR? I'll say no, you do not get a false positive PCR if you are vaccinated. You can get a positive antibody detection test, which is not a diagnostic test per se, which this test, antibody detection, only tells you about antibodies which are produced in response to the vaccine. It does not diagnose the COVID disease per se. They also want to know, many people also want to know, do we get antigen positive if I am vaccinated? No, you don't get even antigen positive, because vaccines, even if we are using whole virus vaccine like the one vaccine which we are using, antigen is not detected in the nasal secretion or oropharyngeal secretion. So antigen test positive or RT-PCR test positive purely means that you have a COVID disease. So the other question people ask is, if I get an infection with a variant of concerns, especially the UK variant, will I miss the diagnosis by RT-PCR? My answer is no. Most of the diagnostic kits which are available are actually picking up 2 or more than 2 genes. So there is no test which is picking a single gene, that too S gene. The variant of concern of UK strain has signature mutations in the S genes. We are not using currently, most of the kits do not use the S gene detection for diagnosis of COVID disease. So the genes which are often used are E gene along with either ORF or RDRP gene. So S gene is not commonly used. There are some reagents, some kits which are commercially available. They are using S gene, but they are using S gene also in combination of that, in combination of other genes. So there are there are no chances that the diagnosis will be missed. There is a common saying which people are talking about these days, is that often you get your RT-PCR negative and you get positive CT findings in a case. So CT changes are visible and test is negative. I would like to emphasize that when they say test negative, they usually talk about the antigen test, which is done in the field. Antigen tests are low sensitivity tests. They are not high sensitivity tests. So they miss about 50% of the cases. They only pick up the cases where the viral load is very high. Low viral load they miss. CT changes in most of the cases occur after 5th day of illness, when the virus load start decreasing. So there is a chances that either patient was not swabbed properly, sample was not collected properly, or the test chosen was not correct. That's why you get a negative test and positive CT finding. Very, very rarely you will find that the virus has disappeared. Either it's a very late phase of the disease, then you find these kind of things. So these are the common questions which people are asking in the second wave, which were never asked in the first wave. Then often people ask, which has been very, very aptly answered by Dr. Anurag and Dr. Gularia also, that why this peak is so sharp and so big and when this is going to be end. I cannot predict that. So there are a lot of models which are available. People are talking and predicting. It seems like we have almost reached at the peak. It's a grim situation. We all understand, but I cannot predict that. So over, and if there are any questions, I'll take it right.
धन्यवाद। और मैं संजय सिंह से रिक्वेस्ट करूंगा, जो कि सेल्फ रेप्लिकेटिंग मैसेंजर आरएनए वैक्सीन बना रहे हैं, कितनी जल्दी इनकी वैक्सीन मार्केट में आने की चांस है और कौन सी स्टेज पे है? डॉक्टर संजय सिंह।
Thank you, sir. First thing, I'm very humbled to be invited for this August gathering. Professor P.K. Seth was my MSc final year expert for the interview. He was next to director during I did my PhD, and I'm so honored that invited by Dr. Kambuz, who was my director when I was doing my PhD. And I would like to say that he made me like bad because I was having a 5 crore fund to do my research as a PhD student. So Walter Reed Fund. So now I'm coming. So now I'm coming to mRNA. Why we decided to do mRNA vaccine? mRNA vaccine we decided to do because of two reasons. We were already working on mRNA vaccine for last 3 years for personalized cancer vaccines. Because there the manufacturing is very fast. You can start in the morning, by evening the vaccine is there. And the second part, which was most difficult in last 10 years when Moderna and other BioNTech was working, the delivery system. How you deliver mRNA, because once you deliver in the body, it gets destroyed very fast. So can you create a protective mechanism? So this is with my collaborators back in Seattle. We solved this because our mRNA is not inside the ball. It is on the surface of the ball. So it is much more stable. But the problem is though the DVT, I appreciate DVT was very conducive, but the committees which are there, which is reviewing it, they get very worried about as soon as they see some new innovation. And they start asking the questions which are not relevant, because most of the people who are sitting in these committees, they have never developed a product. So I was forced to follow two back preclinical toxicology, because this law has been implemented in 2019 through RCGM, and it's taken us 7 months. But it's all right. It's part of that time. So now we have gone into the phase 1, phase 2 clinical trials. We are having a very positive result. We have done tons of immunogenicity experiments. So one of the questions was, I hope if God is gracious, by July or August we will be in the market. And we have around 180 million capacity to make the vaccine. But what new thing we have introduced, hope our vaccine will be, mRNA vaccine will be stable at 2 to 8 degrees centigrade, because we are doing this innovation for India. This is the first thing. Yes, we are also talking to WHO, World Bank, and Gates Foundation for the scale of close to 1 billion doses. Now the next thing comes that what this vaccine does and what is the effect on muting and longevity of the vaccine. So we have used self-amplifying mRNA because you give the mRNA, single mRNA gene, and it's self-amplifying roughly 20 times So it slowly induces your immune system, and it hits the germ cell. If I'm going too scientific, it hits the germ cell, and germ cell gives the memory. We are getting the best germ cell response at present as compared to Pfizer and Moderna. If we succeed to that, what we have seen till now, because Dr. Anurag's team has just published the mutation data, they were keeping it safe. I do not know why for a very long time. But we have not made peptide, but other peptides which we have made, we can see that when either Brazil or the UK or the South African, when we are uh, infusing those peptides, it is enhancing the immune response. So that is fine. Now there is one big discussion between me and Professor Padmanabhan. Professor Padmanabhan says that if the titers are very high, if the vaccine efficacy is beyond 95-96%, then possibility of mutation is not going to affect very much. We have to see it. But in the meantime, where we will stop for 4 months, we have made all the 3 constructs, Brazil, UK, and South Africa. And now hopefully in next 10 to 15 days, because this paper appeared, I think 3 days back, Dr. Agrawal, 3 days back or 4 days back. So we have taken the sequence. We are following the SAID as much as possible. And we have put that sequence because here within 30 days, you can make the new variant. So we are also making another version where all 4 variants we are going to put into. The question has been asked by somebody that how the mutation will go. So this is based on the population and pharmacogenomics and pharmacoimmunology of the population. So there is one Caucasian population, which is UK, US, all that. Second is Latino population, which is the Brazilian appeared. Here the UK one appeared. And third is the South African population, where the South African increased. I was dead sure that new mutation will come to India. And I had a meeting with Dr. Sarup around 4 months back, and I went to her office and I said, we should start serious surveillance when Yavatmal or Nagpur infection rate was there. Still, I feel there should be some more pressure needs to be done. All the high transmission zone has to be keep on doing it. But I hope that our immunogenicity data comes, if we can neutralize with one vaccine all the 4 variants, that will be fine. So this is our effort we are doing at present. Again, thank you very much for inviting me, and hopefully we will succeed with mRNA in India too.
थैंक यू संजय, हमें आशा है कि आपका सारे वेरिएंट्स जो है उसको न्यूट्रलाइज करे आपकी वैक्सीन. डॉक्टर दास, NICD, stage is yours now.
Am I audible, sir?
Yeah.
Okay. Good evening, and I first of all express my most sincere thanks to Professor Balram Bhargav, DG ICMR, for nominating me to represent ICMR over here. So this Professor Gularia has given a very exhaustive overview of the current situation, and which is in line with the theme of the webinar, that vaccine hesitancy and vaccine advocacy. So I think I would like to, as a clinician doing immunology research, I'd like to mention a few important issues that I believe that needs to be overemphasized at this point of time when we are in the midst of this second wave, and also rapid vaccination drive. Now, the one thing is that like vaccine hesitancy, which was as Dr. Kambu just rightly pointed out, it doesn't perhaps no more exist because people are standing in long queue to get vaccinated. But this response is rather less because they have become more educated about the vaccine or the protection the mechanism, and more guided by the rapid increase and the people's difficulty in getting proper treatment that they are seeing around. So that is driving their crave for vaccination. But at the same time, they need to be, I believe, properly educated what actually the vaccine will benefit, how the vaccine will benefit themselves, their family members, and larger population. Otherwise, these things will not persist, and then if this wave goes down, then they will again they will not come forward to get vaccinated. So now, one thing is important is that what has happened with the vaccination, which has, I believe, partly contributed to this second wave, is that people have taken off the guard when they got a single dose of vaccine. So I think at this point, when vaccination is now being expanded, it must be emphasized that they cannot do that. They have still maintained the COVID-appropriate behavior, and as we all know about that, wearing masks and washing hands. But then, the question they may ask to themselves that, what is the point? I'm anyway doing this, so then why to stand in long queue to get vaccinated and take all the pressure? So here I think, the healthcare workers and the community leaders, they have a great role to play to make them understand that, first of all, even a single dose will cause decrease in the, studies have shown, decrease in the severity of infection, if not the incidence. And second thing is that this also will give rise to lesser, because lesser and lesser people will be infected for a prolonged time, which gives the vaccine to get mutated. So there will be less and less chance of a mutant, the variant, to come up, which will escape the, which will have the probability to escape the vaccine. So for these reasons, this is important that to decrease the chance of the mutant development, which will eventually maybe escape mutants from the vaccine, and at the same time decrease the severity of the disease in themselves. So this is, I think, one thing. And the second thing is that, coming with that, with this, that as the previous speakers have rightly pointed out, that we will not really have enough vaccines in a short time to give full vaccination to even the intended population now, which has been expanded to the 18 years of age, anybody above 18 years of age. So now this is there is a policy matter whether to give more people a single dose or to give those whom to give the priority, those who have already got the single dose, giving them the second should be the priority, or giving more people the first dose to be the priority. So this has to be clearly defined on scientific basis, I think. But to my mind, it seems that covering as many people, because even the single dose has shown efficacy, covering as many people with a single dose may be a good idea. But there are some issues regarding escape mutants with the single dose, which I believe from an immunology background, that a vaccine which is giving immune response to multiple antigens is really not very likely that the immunized person, even with a single dose, will have enough chance to develop an escape mutant vaccine, escape mutant virus variant. Because we have some inactive dead virus vaccines like hepatitis E or rabies vaccines and some influenza vaccines. So we have not seen much of that escape mutants there. And also this virus, it's a non-segmented RNA virus, so it is not as mutant prone as influenza virus. So I think, to my mind, this is, I think, is the should be thought of really, that if we can, with the limited vaccines that we will likely have, in comparing to our huge demand of the population, that probably covering as many people as possible with one jab may be a good idea. But that is, I leave on the experts to take a policy decision on this. But again, I'm saying that even people have to be properly, convinced about maintaining, convinced on scientific basis and through whatever means, like say that this social media has become, a tool for spreading a lot of misinformation. But this same social media may be used innovatively to spread this information, that why should they continue, COVID-appropriate behavior and why this is not a kind of a should not be a deterring factor for them to get a vaccine. So I think that is at this point to me seems to be important issues. And then I will be available for addressing further questions. Thank you very much.
धन्यवाद डॉक्टर दास। डॉक्टर सेठ ने शायद चैट बॉक्स में जो क्वेश्चन आई है वो देखे होंगे। उससे पहले मैं एक क्वेश्चन पूछना चाहता हूँ डॉक्टर अग्रवाल या बाकी लोग जो भी रिप्लाई करना चाहते, कि देखा गया है जैसे आपने 1918 और 1919 का जो वायरल स्पेनिश फ्लू का पेंडेमिक था, फर्स्ट पीक छोटी थी, दूसरी पीक बहुत बड़ी थी, तीसरी पीक ने खत्म कर दिया। सार्स कोवी-1 में भी यही हुआ कि वो भी वायरस अपने आप ही खत्म हो गया, मर्स वायरस भी अपने आप ही खत्म हो गया। कि ये तो नहीं कि दुनिया को हम लोग इतनी बड़ी दुनिया है, सभी को वैक्सीनेट करने से पहले थर्ड ऐसा म्यूटेशन आए कि वायरस अपने आप खत्म हो जाए। डॉक्टर अग्रवाल या एनीबॉडी एल्स टू कमेंट ऑन दिस?
Sure, sir.
उसके बाद
I'll take a
डॉक्टर
shot at
प्रोफेसर
it.
सेठ जो चैट बॉक्स में क्वेश्चंस आए वो पूछेंगे।
आपका first of all, sir, point is very well taken. In trying to vaccinate the world might be an impractical attempt as it appears today. Again, I'll go back to something जो we have learned. In terms of being able to create vaccines, the world has changed a lot. Especially with the mRNA platform technology, it is indeed possible to rapidly adapt a vaccine, and you just heard how just after getting the sequence within a few weeks, this can be started. Within January 2020, after the sequence of the SARS-CoV-2 went on virological, by the end of that month, at Modona, they were already building the vaccine. So, sir, I think it will be a process of continuous evolution. We live in a different age today. Mortality was more acceptable and people were more fatalistic 100 years ago. Today, people will ask, if science and technology can prevent these deaths, why don't we try? So for that reason, I think we'll continue to evolve better vaccines. And I particularly like the important talk given by Dr. Sanjay Singh, in which we talk about the flexibility of these new platforms. The way I see it is we have working platforms like old petrol cars. We also have new Teslas coming. They will both run side by side until we know that the Teslas are good. And then I think the world will change again. So I'll stop here, sir.
Thank you very much.
So, Dr. Kamboj, I would like to add a bit on this.
Yeah, please.
Because I was part of the SARS-CoV-1 task force at NIH when in 2000 it came. The size of the SARS-CoV-1 was only 30 nanomicron. In polio, it is like 4 to 5 nanomicron. So infection is very, very slow and very, very distant. As compared to this unique virus, this size is around 100 nanomicron. So it doesn't need anything to ride on it to people infected. And because of this infectivity is so high. Now the question is, your question might be, if I can rephrase it, is it possible that its own mutation kills it? No, I don't think it is possible. Because this has been transmitted in so many people, so hundreds and hundreds of millions of people transmitted, that chance has already been taken out. Only the virus is improving and improving. So we have to beat the race of the virus by killing whatever improvement is coming. That is my answer.
थैंक यू संजय, ऑप्टिमिस्टिक हो तुम, तो इंडस्ट्री वाले हो, चाहोगे कि वायरस जल्दी ना जाए रहे। इसके बाद प्रोफेसर तलवार से यहाँ पर जिन्होंने वैक्सीन शुरू किया, मंजू जी, या प्लीज, मंजू जी, you want to say something?
I want to ask, is it the infection is spreading because of the variants which have now come up? And that's what everybody says. So many variants, and the Indian variant is basically largely responsible for the second wave. So, as Dr. Gularia said, that one of the vaccine, Covaxin, is also working against the Indian variant. But is it possible that in future we'll be able to have so many vaccines which will work on these various variants to check the pandemic? Is it possible?
Ma'am, at present, the only two ways, one, what Dr. Agarwal said, that we have to vaccinate and we have to see that what is the breakthrough infection is coming in. Breakthrough, we have to sequence and how it is happening. For example, at present, there are two variants in India, and Dr. Agarwal can correct me because we started our own program. We got so much disparity, we started our own program. So one variant is double mutant, which is present in Maharashtra area, and another variant which is coming in Delhi, it has triple mutant. But these are not the only mutant. There are around 14 changes in these things. But the major is this. So at present, virus is improving itself either against vaccination or its better infectivity. Virus is improving based on the immune response of the population. And this wave which has come at present, it is only due to mutation. In South Africa, in November last week, the South African new variant came, and within 3 months, it taken over whole South Africa. UK variant went into US. Within 2 months, it has taken over all the things. So what Dr. Agarwal said, and he can correct me, that at present, we hope, at present, 62% is double mutant in Maharashtra. 62%, our analysis says. Maybe within a month, either double mutant or triple mutant will take over the whole country within next 2 to 3 months. So surveillance is very, very important. We have to keep on testing our vaccine efficacy very effectively, that whether our vaccine is working or not, if we have to.
Mr. Sanjay, ma'am, I want to add something about the sharp peak which we got this time and why it was that big. There are many contributors to it. It's not only the mutants which are contributing. And one of the important contributors was that the vaccine rollout was very patchy. So it was only a certain population which was getting vaccinated, and people started believing that they are protected. So they were not protected. Only a small population was getting the vaccine. And so the behavioral changes which happened, which we call a COVID inappropriate behavior, because of that, people forgot that the COVID is there. So there were many reasons for it. There were mutants, the behavior of the people changed, the vaccine was actually there but was not available to most of the people, which people did not acknowledge. They believed that since the vaccine is available to certain population, everybody is protected. So there are many reasons for that, and because of which, as Dr. Gularia has rightly said, that the history has truly repeated itself. We knew it may happen. We knew that this is the fate, and still we forgot it all over. So that's why we saw that, and probably if we do not change our behavior again, we might see a third wave. So, and many countries have seen third and fourth smaller waves also. So we have to be careful from this point onwards.
Thank you, Amita ji. Dr. Talwar is no more there. Dr. Narendra Mehra, would you like to say a word?
I have been following the COVID-19 for all these years. You know, one of the points that has been raised is why the variants always continue to evolve with the potential to evade immunity. And you know, the answer to that is because relatively few people so far have been vaccinated in the world. And the more the virus replicates, the more the variants will come. And we have to look at the UK experience. And the UK have done very well. Look at what was happening there in January, February. All of our friends and their children were there in London, and they were saying we have the lockdown. And they had the severest of the deaths happening in UK at that time. But they did a smart thing. You know, the vaccine that they had, the AstraZeneca, they had a gap of 12 weeks rather than 4 to 6 weeks that we had. We have now increased it to 4 to 8 weeks. So within 12 weeks, they were able to vaccinate as many people as they could. And today, one of the tables that I got, figure that 70% of England's population now have COVID antibodies. So I think the point that has been stressed again and again over here is that vaccination is the key, and we need to really vaccinate. But the point is, now that we have opened the vaccination to all the adults, and you know, your COVID sort of portal is full of requests now. we need to vaccinate about 10 million people in India every day. We are only doing about 2 to 2.5. I think that's too less. Hopefully, with Sputnik V coming in and the Covishield can increase its productivity, we will probably have about 5 to 6 million a day. That would also be good if we can really jack up our vaccination to that much. Vaccination really not only helps to save you from hospitalization, it also helps the virus not to mutate as much. Because the mutations will also probably go down. So I think vaccination is the key for us.
Thank you, Professor Mehra. Professor Seth, are there any questions in the chat box? Dr. Seth? Questions in the chat box?
Alok Dhawan was raising hand. Is he still around?
Who?
Alok Dhawan.
डॉक्टर साहब मैं एक सवाल पूछना चाहूंगा मैं सुधीर मल्होत्रा मैं एक सवाल पूछना चाहूंगा अगर आप अलाउ करें जो है
हाँ जरूर पूछिए
जल्दी पूछिए
हाँ डॉक्टर साहब मैं I want to ask the panelists who are there and they are very distinguished panelists. What is the reason why this coronavirus pandemic has hit about 200 countries, more than 200 countries? So what's the reason why in India, especially since last 1 month, since the holy time, 27th of March and today is 29th of April, roughly about a month, this turbulence and the infection and the mortality has been phenomenal because this pandemic is there in so many countries. If you go to the data, sometimes I get bewildered that the cases which are coming in Lucknow city are equivalent to the cases which are coming in Pakistan. The reported official cases coming in Pakistan, which is a country, and Lucknow is a city. And for that matter, India is reporting 3.5 lakhs cases every day, and the second hit country, Brazil and America, they are coming 70,000. So why this virus is showing its lethal behavior?
जी आपकी आबादी बहुत ज्यादा है जी आपकी आबादी बहुत ज्यादा है अब ब्राजील की आबादी और भारत की आबादी का आप मुकाबला कर सकते हैं आपकी आबादी 126 करोड़ है और उनकी 1 करोड़ है तो आपका इन्फेक्शन उतना ही ज्यादा होगा
नहीं सर पहली वेव में ऐसा नहीं हुआ था लास्ट ईयर ऐसा नहीं हुआ था ये अभी ऐसा क्यों
लास्ट ईयर तो इतना वो हुआ नहीं था ना ज्यादा Alok Dhawan.
Sir, thank you so much. I think, yeah, Anurag, you want to say something? Go ahead.
Let me just answer that. First of all, I have to acknowledge that Dr. Sudhir Mehrotra has a very important point, and let me tell you why that is so. If you look at husband-wife co-infection rates in September, October, लोग तो वैसे ही रहते हैं sir, husband-wife. It was around 25-30%. Within a family, typically less than half the people got infected. This time, starting from January, February, it's been different. Every member of the house is getting infected. If you look at a distribution of CT values, CT value distribution last year had a median around 25. This time, the CT value distribution has a median around 18. So you are very right, Dr. Gularia, that the virus has changed. But exactly as was pointed out earlier, it is not only about the virus changing. The virus still cannot jump through a mask. The virus still cannot, infect in situations where appropriate behavior is being maintained. But it's a combination of two very important things. Is a more transmissible virus. We saw UK and Brazil suffer through it. It is also a combination of laxity on our part. And to some degree, you anticipate the preparation that is required for a country of our population, very limited number of beds per 1,000. All three are together, sir.
Thank you. Sudhir, can you mute your mic, please?
Sure.
Just one, I just want to pick your brain because there was this discussion with one of the clinicians in the US. And we were saying, when we'll find a cure for COVID. And his perspective was we haven't been able to find a cure for the Spanish flu yet. And we have a flu jab every year. So we have to learn how to live with it peacefully and help ourselves to be able to fight it out. So I think what Sanjay was mentioning, rather than a company, I think he was mentioning as a scientist that end of the day, we have to find good vaccines. try to find out the strains well in advance. So because these have been existing as a flu jab in Western world, India was not having these flu jabs. Perhaps we now across the world have to have a flu jab every year, depending on the mutations that are existing. And maybe over some time, the virulence will go down and it will become like a common cough and cold, and that is fine too. But as of now, it doesn't seem. But I think that's how it's going to go.
If I can make a very snappy point over here, at the moment we have all been focusing on the vaccines. Not much attention has been paid to sort of develop more therapeutics. Now we are seeing a news coming up that there's a drug, there is an antiviral drug, Monopiravir. Probably it might come to the market in about a couple of time. So those kind of things have to be also looked into. We have been only focusing on the vaccine so far. Therapeutics have gone at that stage. So some amount of work will also have to be done in developing new drugs and all.
While nasal nitric oxide has been found very successful in Canada and UK, what are the comments about that?
So before that, if I may say, sir, that like Professor Mehra mentioned, I think it's also important that as of now we are looking at drugs which are viral directed. I think people are now also wanting to look at drugs which are host directed that can prevent. I think those are various aspects that are being looked into across the world, and people are trying to come up with different platforms to address these situations.
नहीं, but अभी तक हमने वो ड्रग्स यूज की जो कि एबोला के काम आए, जो कि उसके काम
correct. I got the point, sir. Correct, sir.
Regarding the nitric oxide question, that study. Go ahead, sir.
Yeah, go ahead.
So the question was,
Professor Seth, any questions in the chat box?
Yeah, I will just take up. They were not. Yeah, can I?
I think Dr. Anurag Agrawal has to make a point on nitric oxide, and then
Anurag, go ahead.
Yeah. So nitric oxide, sir, in that particular study, they were not looking at clinical outcomes. They were looking at viral load in the mouth and in the nose. I will only submit to this panel that if I were doing betadine gargles and mouthwashes, the load of the virus in the mouth would have been very low by day 3. So while it is promising to see that nitric oxide can kill the virus, I would not take forward from that it will reduce the disease. If it is limited to the nose and the mouth, that is not where the disease really occurs. And number 2, not a single antiviral, including Tamiflu or Remdesivir, has given clear clinical outcome benefit so far. So I would be cautious on that.
Okay. Yes, Dr. Seth.
Yeah.
Dr. Seth,
I had gone through those chat box, and what I find that the question are very general type of questions. So someone is asking that when will be the vaccine available for neonates and the children? Another question is that 18 people who are at the younger age are getting more infected as compared to the others. What is the reason? So I think that there are simpler type of the questions which are being raised. Of course, for the scientific basis not there, but maybe that will be of the interest to the people, individuals. So unless other panelists want to add anything, I think these are the questions which are very, very different type of the questions which the panel is supposed to answer. But I would take this.
So Anurag wants to answer the question.
Yeah, Anurag,
There is something very interesting about this question. You look at almost any viral disease, including the Spanish flu, it's always the very young children that die and the very old. What is unique about this particular one is that young children have not died. In fact, it is very interesting. So why young children have been so resistant to it? Earlier, people thought maybe they were not getting infected. Now we know they are. In IIT Jodhpur, we have followed more than 100 pregnant mothers who have delivered. The children are getting infected. There is no doubt about it. Which brings us to a very important point relevant to today's discussion. It is about ineffective immunity versus effective immunity versus immune storms. And it seems, and this is also, by the way, the only time asthmatics have not done worse. As an asthmatic myself, I track this quite carefully. Normally, any viral infection comes, asthmatics are the first people who require hospitalization. Here, asthma is protective. So some people think that a Th2 state of immunity early in life might reduce the inflammatory storm and maybe prevent it. That is the best answer, sir, I can give for the time being. That a early Th2 type state with low immune response might be sufficient to let this virus clear itself without damage to the lung, is ultimately what kills people.
Sanjay.
Yeah, so as Dr. Mehra has said, that molnupiravir has been licensed to 5 companies from Merck, and our parent Merck has been one of them. So we have started working on it. But that also their phase 2 trial results are saying that it is not good enough for the hospitalized one, but pre-hospitalized it works. So we are working on it. Now, second is in the host-directed defense. So we started some work on one of the IL-1 antagonist. It is enactilna. It was suggested by Professor Sareen many months back. So we have produced that drug, and we are all set to go for the trial next 45 to 60 days, because its quantity is very heavy required. This is already repurposed drug. So what it does, it stops the cytokine storm. So most of the patients which are dying, they are not dying only because of the virus. They are dying because of the host-induced response which comes and cytokine storm that kills them. So we are working on it and hopefully see how the trials, though there are 13 trials has been done, but Amgen, who is the innovator in this drug, they have not shown interest into it because the cost, the dose which has to be given is 1.2 gram. The recombinant protein 1.2 gram, but if it saves lives, we are working on it. So let's see how the results come. So it is very important to look at the host-directed responses to control them. Thank you.
Thank you. I'll just take a minute to personally thank each of the panelists, and especially the SOS call which I made to Dr. Kamboj this morning to take it over from me in totally coordinating it. And all Anurag Agarwal, Dr. Amita Jain, and Sanjay. Sanjay is a pride of Lucknow, as I can say, as far as the industry is concerned. And he mentioned about it. In fact, he always, I find him very bold, initiative, and very, very outgoing person who will take any risk and do the work. And you see, this is the first the vaccine with the RNA base is going to come. And also, I thank DG ICMR for nominating Dr. Das for this, and also Dr. Manju Sharma, our president, Dr. Ghatak, Dr. our past president, Dr. Kamboj, and all of us. And I see Dr. Ashok Mishra was also there. So it's very, very, it was a very GP, as we call it, Padmanabhan. It's a very, very, I think I feel very much satisfied in having this, which I did in the guidance of Dr. Manju Sharma. And it's a very, very useful. I'm sure people will find it very, very informative. Thank you very much.
Thank you very much for organizing this beautiful event.
Thank you, sir. Now we are coming to the last part of expressing vote of thanks, formal vote of thanks. And my colleagues, Dr. Santosh, A.K. Srivastava, Mr. Deepak, all extended their helping hand to organize this. Although there is a complete lockdown here, the roads are blocked, but they are managed here. So in the end, I would like to request Ms. Arshana Pant. She is the person who has sent notices to everybody, and she is coordinating on this part right from the first seminar, and this is the 24th. So the credit also goes to her, and I request her to kindly express vote of thanks. Arshana ji, please.
Thank you, sir, for your kind words. Very good evening to everyone present here. So we had a very fruitful discussion on the very important aspects of COVID, that is building confidence on COVID vaccine. And the theme was also most relevant to the current scenario because we all know that the entire humanity is battling the second wave of COVID. There is a growing evidence of the double mutant, and vaccination is the only way out. It is the most potential instrument or the weapons to fight against the pandemic and also to prepare ourselves for facing the third wave if it comes. And now it's time to express gratitude to all who have extended their support to make this event fruitful. We all know, as already mentioned by many of the eminent experts, that National Academy of Sciences India has a mandate Science and Society, and for the last several years or since its inception in 1930, it has been effectively pursuing this very mandate by organizing several programs. But for the last 1 year, NASI has been constantly spreading awareness, enlightening the masses on various COVID-related aspects with major focus on two crucial aspects. That is, number one is nutrition, portion, which is very much related to the COVID, and secondly, Jagrukta Abhiyan, or following the COVID-19 appropriate behavior. And this all started immediately after the announcement by our Honorable Prime Minister. And in fact, these are the two prime initiatives of NASI under the chairmanship of Honorable Madam Dr. Manju Sharma ji, NASI Distinguished Women Scientist Chair and former Secretary to the Government of India, Department of Biotechnology. So at the outset, I would like to express my profound gratitude to Honorable Madam for taking this initiative to start the program for this very noble cause. And under her valuable guidance, we organized several programs. This is the 24th webinar that we are organizing. So we all extend a very sincere gratitude to Honorable Madam for her valuable guidance. Thank you, ma'am, for sparing your time to be here with us and highlighting the mandate of NASI, Science and Society, by giving the glimpse of several Science and Society programs and with various statistics of the recently organized program. And we always look forward to your kind blessings and guidance. Thank you so much. We are also very much thankful to our Honorable President, Honorable Professor Ghatak sir, for all his cooperation and guidance and support to all NASI's activities, and he has been very much instrumental in these webinars. So thank you so much, sir, for gracing the occasion and giving the preview of present situation and how to cope with, especially with following the COVID-19 appropriate behavior, with the take-home message that large-scale vaccination is the need of the hour. Thank you so much for all your support. We are honored to have Honorable Dr. Randeep Gularia, sir, a renowned pulmonologist and also director of All India Institute of Medical Science, who, in spite of his several commitments and busy schedule, has very kindly accepted our invitation and agreed to inaugurate this event. So we are very much grateful to him, and he has enlightened all of us, especially the students and the researchers, on this very important aspect, given the current situation in India, which is reporting the second highest number of cases. And he also gave reference to the earlier pandemic that occurred with highest number of cases and in all the three waves. And he also mentioned the strategic response by All India Institute of Medical Science, Delhi, in terms of infrastructure and research, and also with the mention of COVID vaccines, vaccine design, different vaccine platforms, vaccine efficiency, and of course the major challenges which are very obvious. The new strains are emerging, and vaccine delivery, distribution, and many other aspects, and also gave reference to some very important studies published. And with the message that despite of this vaccination, we need to follow the public health measures and we have to follow COVID-19 appropriate behavior. And of course, quick, efficient, and equitable delivery of vaccine is very important. Thank you so much, sir, for sparing your time and enlightening us. And your kind association with National Academy of Sciences India will go a long way, and we would like to listen to you again and again, and we look forward to your valuable suggestions and your expertise in our future events. Thank you so much, sir. We are very much thankful to our Honorable past president, Professor G. Padmanabhan sir, who is the past president of NASI and former director of Indian Institute of Science, for delivering all his support to NASI's program. Sir has also been very much active and instrumental in all these webinars, and he also enlightened us on the various aspects of COVID. Thank you, sir, and for this thing, for also giving the message that COVID appropriate behavior is a must, and drug can only provide treatment, but we need to follow this COVID appropriate behavior. So thank you so much for your presence and enlightening us, sir. We are also very much honored to have Honorable Professor V.P. Kamboj, sir, the past president of NASI and former director of CDRI, for sparing his time and giving his valuable suggestions, and also very nicely moderating this panel discussion, and with the key message that COVID appropriate behavior is the only way despite of this vaccination. Thank you so much, sir, for sparing your time. We are also very much grateful to Honorable Professor P.K. Seth, sir, the coordinator of this program, who has been very much instrumental for the last many days in planning this program and coordinating with the experts. Thank you so much, sir, for providing your guidance and all your support, due to which this program could be successfully organized. And we are also very much thankful to Honorable Professor P.K. Tandon, sir, the CEO of Biotech Park and distinguished fellow of NASI, that for all its contribution and support to NASI's program. Sir has also been very much active in all our past attended webinars and enlightening the general masses. And thank you, sir, for welcoming our guest, and also gave a glimpse of the events organized by Lucknow chapter under your eminent guidance. In fact, the entire Lucknow chapter is very much active under your guidance. And you have organized several sensitization workshops for the betterment of the society. And also, you have presented the better coping strategies to deal with the pandemic. So thank you very much, sir, for organizing this entire program. In fact, Dr. Suchita Banerjee, ma'am, Dr. Tripathi, sir, Dr. Alok Dhawan, sir, is here. So the entire team of Lucknow chapter truly deserves the credit for organizing not only this program, but all other programs of NASI. So we are hearty extend our thanks to each and everyone present here. We are also joined by several renowned panelists, renowned scientists, Dr. Anurag Rawal, sir, Director of Institute of Genomics and Integrated Biology, Delhi, Dr. Amita Jain, ma'am, Professor and Head from Department of Microbiology and Pathology, KGMU, Lucknow, Dr. Sanjay Singh, sir, CEO, Innova Biopharmaceuticals Limited, Pune, and Dr. Das, sir, from NICET, Kolkata. We are very much thankful to all of them for very kindly accepting our invitation and sparing their time to join the panel and discuss on various aspects, and also responded to the several queries of the participants and the experts over here. So we are very much NASI headquarters and the NASI Lucknow chapters extend its thanks and gratitude to all the speakers. And we are also very much thankful to several past presidents who have attended this webinar and for their support. Professor Ashok Mishra, sir, is there, Professor Mittal, sir, is there, and also Dr. V.P. Kamboj, sir, and and Professor Chandrima Shah, madam, is also there, past the Honorable President of INSA, for attending this webinar and providing their inputs. We are very much thankful to distinguished fellows, members of NASI, and also the chairmen and secretaries of the local chapters who attended this webinar, and they also extended their helping hand whenever and required. And with their kind support, NASI could organize several webinars on this very issue, that is COVID-19 appropriate behavior. So we are very much thankful to everyone. And we are also joined by several other fellows like Professor S.R. Joshi, sir, Dr. Anupam Dikshit, sir, Dr. Anupam Chatterjee, sir, Dr. Banerjee, ma'am, is there, Dr. Shubhra Chakravarti, ma'am, is there, Professor Krishna Mishra, madam, is there, Dr. Rata Langan, madam, is there, Dr. Peter, sir, Dr. Rajendra Dobal, sir, and many other eminent scientists. I may forget to tell their name, but we are very much thankful to each and everyone for their kind cooperation. And we are also thankful to our General Secretary and Treasurer of NASI. And I also extend my sincere thanks to Dr. Neeraj sir for all his support and generous help, not only for this program, but all the activities of NASI, and also coordinating with the experts. And we also extend our sincere thanks to other executives and staff of NASI for their kind help and support. And with these few words, I would like to once again thank everyone, and we look forward to such more events in future. Thank you, everyone.
Thank you, Ashwin. Hope we can finish now this program. Professor Seth, sir, should we close this program, sir?
Yeah, please.
Thank you.
Already time is over.